Hello everyone, this is Dr. Minister again. Let us now discuss about viral encephalitis. Okay, what are the common causes and how they present and what is the treatment, right? So common viruses which lead to encephalitis we'll see. Herpes simplex virus, HSV1, which is most common in adults. Other than that, even HSV2 can be there, varicella zoster virus and cytomegalovirus, that is herpes family. Right, but these are like CM if you see, they are common in immunocompromised patients, even varicella zoster. Other than that, arbovirus like West Nile virus, Japanese encephalitis, and St. Louis encephalitis. Enteroviruses can also cause encephalitis like Coxsackie virus, ecovirus, which are common in children. Okay. Next is rabies virus. They're rare but fatal. Once the symptoms are have occurred, then there is 100% mortality. Pathophysiology, what happens is there is a viral invasion to the brain parenchyma causing inflammation and neuronal damage. Okay, so HSV has temporal lobe hemorrhagic necrosis. Specifically, HSV will affect the temporal lobe. Immune mediated mechanisms can also contribute with that. Symptoms, early symptoms like fever, headache, altered mental status, then seizures, focal neurological deficits can also appear, like weakness, muscle paralysis, or focal seizures, etc. Behavioral changes in temporal lobe involvement, like in the case of HSV, right? And coma can also be there in severe cases. How do you diagnose? CSF analysis. What do you see in CSF? Lymphocytic pleocytosis. Elevated protein and glucose will be normal as it is viral infection, right? Then we can go for PCR for HSV DNA in the CSF. That is a gold standard diagnosis. Okay, similarly PCV PCR we can use for other viruses also. MRI we can use specifically for HSV PC. There is a temporal lobe lesions, right? EEG will show periodic lateralized epileptiform discharges. Periodic lateralized epileptiform discharges. Viral serology can be done for arbovirus and CMV virus. So how do we manage? If it's herpes family, that is HSV, varicella, then acyclovir is the treatment. You have to give for 14 to 21 days. Arbovirus, there is no treatment for like West Nile fever and all. We have to give supportive care and anticonvulsant therapy. CME encephalitis, we can go with ganciclovir, 5 mg per kg IV BD for 21 days. Rabies post-exposure prophylaxis is must, like vaccination and IVIG. Okay, once the symptoms are occurred, there is 100% mortality, as I said. Acyclovir dosing will see in adults 10 mg per kg IV every 8 hours. 8 hours. Okay, for 21 days, 14 to 21 days. In pediatric, we use 20 mg per kg. Right? And based on ideal body weight, we have to calculate the dose for obese patients. And monitor for nephrotoxicity and ensure hydration to prevent what? Crystalluria. Right? And supportive care like seizure management with anticonvulsants, ICP, that is raised intracranial pressure monitor, we using control using mannitol and hyperventilation. And steroids should not be used, but for severe last resort you can try steroids. Especially it will cure the cerebral edema, but there is a risk of flaring of the infection. So this was the short discussion of viral encephalitis. Thank you.